Fiona, we're delighted to have you join us for Bias, which is something that we're really proud of that's been part of Science Week for the past couple of years, to look at how we can better in the medical profession as a whole, treating women on all sorts of issues that affect us as we grow older, and all the sort of medical things that we need to look at and how we can be better supported in all different walks of life. And Fiona, you are the head of midwifery and nursing in the Rotunda Hospital. That is a place I know rather well myself. I wonder if we've crossed paths.
For good reasons, I hope.
Yes, yes. So, Fiona, could I start by asking you, how did you get started in your profession?
Well, I suppose I had a very interesting journey. I wasn't born with a burning desire to be a nurse or a midwife. And actually, I didn't really know what I wanted to do. And I knew I worked in an office for 3 years. I did accountancy for 3 years. After leaving school. So I knew that I didn't want to end up just working in an office, that I wanted to work with people. I was very involved with youth clubs and youth work. So I knew my skills were with people. So I looked at different kind of professionals, occupational therapy, physiotherapy, but actually I thought initially nursing would be for me. So I did my nursing initially back in the day, and then moved to London to do midwifery. And went to do midwifery not really knowing an awful lot about it, and just fell absolutely in love with the profession, head over heels in love with the profession.
Was there a moment where, when you were doing your nursing training, that somebody suggested midwifery, or how did that come around?
Yeah, well, as part of your nursing training, you do a couple of weeks in a maternity unit where you're there observing. And I did like it then. I thought, wow, these are healthy women. The midwives are very empowered. So that's why I kind of drew to it. But at the time, really, I sort of thought, I'll go and do the midwifery. It was an 18-month program. I'll do it. And I love nursing. I absolutely love nursing. And I remember thinking, I'll do it for 18 months and I can always go back. And if I want to go traveling, I have 2 qualifications. So it wasn't until I started in midwifery that I fell in love with it completely, I must say. And I say fall in love with it because it is a profession, but actually there is a huge passion for it amongst us that are midwives. Yeah.
Well, Fiona, having been through the Rotunda with my daughter Joan, who is now 11 going on 16, the moments that stood out for me, because we were in there for 11 days with pre and post eclampsia, and the moments that stood out for me in that time period was my interactions with the midwives, definitely.
Yeah, cool. I think what I love about midwifery, and I think, when you interview people from midwifery, they often say, oh, you must love new babies, and babies are lovely, and they are. But actually, pregnancy fascinates me. I think the impact of a pregnancy on a woman's body, if you're anyway scientific, pregnancy affects your hair, your nails, your teeth, your eyes. Like, what other condition would take a hold of your whole body and shake it up for 9 months? At the same time, from 2 cells producing the most perfect little babies, at the same time producing an organ called placenta, which comes into fruition during pregnancy, and once the baby is born has no function. Like, pregnancy is fascinating, and I could go on about it for ages, but from a scientific point of view, when you look at every organ in the body and what pregnancy does to it, I was fascinated that a woman's sense of smell changes when she's pregnant. I don't know whether you remember that. Your hearing becomes more acute.
My smell became really acute, to the point where I was like, I think somebody's making a curry about 6 miles away, and my husband's like, ooh.
Yeah, but isn't that amazing that your body just changes over, that your sense of smell, your hair changes, your nails change. So I think it's that whole, I was fascinated by how pregnancy, and for some women, all those changes are completely normal. And then perhaps for somebody, and maybe like you, the impact on your blood pressure can just be enough to make your body in trouble with your pregnancy. And then what's our role then caring for somebody where pregnancy becomes high risk? And then also the other side is women who have complications, who then want to become pregnant, and how we manage them. So it's the most fascinating area to work in, I think, in the medical field, because any speciality you come across in the medical field, one of those will be a woman who's getting pregnant, a woman with epilepsy, a woman who's had cancer, a woman who's had an organ transplant may present here as pregnant. And that is just, it's fascinating, absolutely fascinating.
And Fiona, can you chart out for people joining this chat, can you chart out how you got to where you were in your career, the steps you took?
Yeah, I mean, I have to say, I didn't plan to be the director of midwifery and nursing in the Rotunda Hospital in Dublin. I'll just tell you that. I had every job I've had along the way I have loved, and thought, oh, I found my niche and I'll stay here. So I worked in London for 11 years in a predominantly community midwifery setting. So I did a lot of home births, birth centre births, driving around London, having the best time ever, radio on, visiting women at home, knowing my families. And then for personal reasons, I moved back to Ireland in 2002, and I got a job in the Rotunda here. And I must say, I mean, I love the Rotunda, but I wanted to try and have the influence to drive change in midwifery in Ireland. And you can't do that unless you have a voice higher up the chain. So sometimes, and it's not a sacrifice, but you have to kind of sacrifice your own satisfaction to have a voice at a higher table. So I came here and worked in the labour ward and worked in postnatal, and then I really wanted to establish community midwifery. So I remember coming at the time, now I was very lucky, I was very supported. I came down to the director of midwifery who was here at the time, Pauline Traynor, and said, you know, we could certainly do something with community midwifery here. And I got a job to set up a community midwifery service in the north side of Dublin, which I did. And we have phenomenal access to community midwifery in the north side of Dublin for our women. And then from there, I thought, well, okay, if we do it here and have a more national voice, you've got to go up the chain a bit higher again, haven't you? So I'm in this current job about 4 years now. Obviously, we've had pandemics and all sorts, but I suppose my role here is to keep driving change in the Rotunda, to have the voice of midwifery strongly heard at national tables. And everywhere I go, I will drive people mad talking about midwifery, talking about maternity services, talking about, you know, I think people have a sense that maternity services are just chocolate box pictures of women having babies, but actually it's far more complicated. So not being afraid to talk about that at national tables and getting the voice of our profession out there, and also encouraging, you know, young girls and young boys to come and be midwives, because it is a fascinating profession to work in. So I think it's the influence part that is really strong in me. I would obviously prefer to go back and just go in my car and go visit women at home and have a personal satisfaction, but actually having a wider impact is really important. So it wasn't an absolute choice to be in a management position, but you have to be strategic in what you're doing if you want to drive change. That's where I come from at it.
Completely. And the idea that, you know, you had an experience working in another country, and all countries can benefit from looking at how other within the medical profession, not just necessarily midwifery or maternity hospitals, what works in other countries, and introduce these policies and put them in place in practice in Ireland.
Yeah, I think Ireland has certainly changed, and we've been very fortunate here with the National Maternity Strategy, because actually now the maternity services in Ireland are very different to what I came back to. There's much more focus on, you know, looking at the woman's needs, woman-centred care, community midwifery. So actually we would be looked at internationally as a very good place for other countries to look at. So we have really accelerated away from where we were from a baseline. Now there's been a lot of investment, but this doesn't happen without people at a higher level in government saying, actually we need to focus on women's health. So I think there has been, I'm sure you've noticed, there's a much bigger focus on women's health in Ireland now. So I think maternity services are in a much better place than they were, and there's a lot more change coming. But with change comes investment and a lot of work to get change in. But certainly I think other countries would look to us with jealousy now, is what we have here for our midwives. And I think trying to attract people into midwifery, but also trying to attract midwives who've gone to the UK or gone to Australia to come home. We have a very good product to say, come and work with us. You'll love it here. You know, you'll love working with us. Yeah.
And Fiona,
we love ideas, we love change. So if somebody comes to me who's been in Australia and has an idea, I'll be like, great, let's look at this and run with it. So, you know, is that hope, having an open mind to change and not being afraid to change.
And Fiona, actually, that leads me to what I want to ask you next. People that are getting into this talk through bias and having a listen to you right now, what sort of skills and attributes in people do you think that they need to look at themselves and acknowledge them to decide whether they're going to be great in this profession or exceed in this profession?
Yeah, I think, I mean, you obviously have to have a level of, it is an academic qualification to become a midwife. But more than that, that's the first 4 years where you're in college, but actually you have to be able to be with people. You have to have the kind of people skills to be situationally aware. Emotional intelligence is huge, to develop rapport with women from all over the world and their families, to deal with difficult situations. So a lot of the students that come in, and it's, you know, it's the way it is, but the points race is very strong to get into nursing or midwifery. But actually the people skills are far more long-term important. Now you can certainly learn some of them, and we would have, you know, young people coming here who may have never had a part-time job even. So anyone who works in the public will know that you learn more about yourself working with the public than anything else. So it is the ability to work with people. And I think you learn more about yourself and you gain more yourself from working with people. So certainly people skills are hugely important. You've got to be able to be, certainly for our job, every day here is different. So you have to be able to just, you know, flex and turn as things change. So an ability to be flexible, and a sense of humor, because we do like to have a sense of humor here. And team working is massive. I mean, we would not function without teams. So you have to be able to work as a member of a team. So that's kind of the main things I would think. And certainly when I talk to students, I always say you will gain more by working in this job than you'll ever give to it, because you do get so much back from it. It's amazing, really.
It is incredible. And I think one of the things that I think of, and it's not just necessarily, complicated arrivals or births or pregnancies, but it is a pressurized environment. And that is something that people need to be cognizant of, I suppose.
Yeah, and I think the students certainly learn ability to prioritize workload, to be organized in your thinking, and not to be overwhelmed, to support peers and be supported by peers. I always think when you work at a teaching hospital, there's always an atmosphere of learning here. So nobody here is ever afraid to answer a question or be asked a question. So I think being part of a teaching hospital is hugely important, because it just has always a question what you're doing. So certainly we support learning hugely here, and that would be the case across the country as well. So the students that come here are very well supported in their learning, and they're protected from the kind of hustle bustle because they're students for a couple of years. But once they come on staff, they have to be able to be flexible and sort of adapt to teamwork very quickly.
You kind of touched on my next question, Fiona, at the beginning, which was like, it wasn't your master plan, but if you were to do it all over again, would you change anything?
Yeah, I think I was thinking about that actually. You kind of do go through these periods of time. I think the pandemic and last year with the cyber attack were two of the most I've never worked. And so it's very hard to kind of sit now towards the end of 2022 and think, is this what I wanted to do? But I feel very proud of how we came through COVID. And I think, maybe I learned more about my own leadership skills than I knew I had. I wouldn't change anything. I would regret never being a midwife. I absolutely love it. And I still feel very much, even though I'm based in an office an awful lot, which I said at the very beginning, I said I did 3 years of accountancy, didn't want to work in an office, and yet here we are.
But you're making change.
Yeah, but I get up on the wards and I meet the students, and my day is so diverse. I never know coming into work what's going to hit me. And I come into work with a plan for my day, and I get one phone call and everything changes.
Yeah.
Like the cyber attack last year, where the whole world for us turned upside down. But no, I would not change it. I think I've been very privileged to be a midwife, I must say, all the years, and very privileged to be involved with families all through my years. Yeah, very, very privileged.
But honestly, Fiona, and I'm not just saying this, I don't really, this maybe isn't a very good thing to admit publicly, but I don't remember the name of the doctor that delivered my daughter, but I remember every single name of every single midwife that we came across. Amy, I could name them off now, 11 years, 12 years later. But Fiona, can I ask you, you are in a female dominated industry, or a part of the medical profession, which is not necessarily common across the medical professions across globally. But would there be barriers, do you think, for women working within the midwifery profession, even though it is quite a female dominated profession?
Yeah, I think where we create our own barriers when we don't realize our power. So, within nursing and midwifery, we're the biggest group of healthcare professionals, the biggest single group of healthcare professionals. So we need to harness our voices and not be afraid to embrace our power. I think sometimes women, and I probably am guilty, sort of feel you have to almost excuse yourself for being at a meeting in a way. And I know when I came into this job, first of all, I used to go to these national meetings and sort of go, oh my God, impostersyndrome.com. But actually, you realize that I often sat at meetings where I said, I'm the only person who's ever worn a pair of scrubs and worked on a lay board at this meeting in the Department of Health or whatever. So I think it's harnessing your power and recognizing that you do have a voice. I think it's really important that we as professionals go out there and are the voice of nursing and midwifery to encourage others to join us and not to be afraid to join us. So I think it's any problems we have are our own and we make them ourselves. We need to be very strong in our voices. It's things like engaging with you, not being afraid to say yes to talking to the press, to have the training to do it correctly, to have opinions, not be afraid to have opinions on things, to form opinions. So I'm part of a group called the Irish Association of Directors of Nursing and Midwifery.
Yeah.
So it's quite a powerful, it's not a government agency, but we certainly have a powerful group of directors of nursing and midwifery. And right across the country, in every root and branch of healthcare, you'll find one of us. So that's power, isn't it?
It is.
Correctly.
And Fiona, before I let you go, what would be the thing that you think you're most proud of in your profession?
I think what I'm most proud of is the community midwifery services I set up here in the Rotunda in 2005 that have expanded and grown. And actually we provide gold standard care in some of the poorest areas of Dublin. So, so families in Dublin that get very little else get amazing care. And our community midwives provide a phenomenal service. I'm very proud of how we managed COVID here. Like our community midwives never stopped visiting women in their homes during COVID. They were out there crossing Dublin out to Kildare to see women with new babies at home because we couldn't stop the service. No. And we did it safely and well. So I'm very proud of that. So yeah, I think very proud of our community midwifery. and has had an impact on the country because there's community midwifery around the country as well. That'd be my proudest, I think, thing to do.
I think you should be proud of that. I think you should be very proud of that. Fiona, thank you so much, Director of Midwifery and Nursing at the Rotunda Hospital. Thank you so much for being part of our bias, looking at women's bias and women's health for Science Week. And it's been a pleasure to speak to you.
Thanks,
and I'd love to talk to you for longer.
Oh, well, anytime. Come in for a coffee sometime and chat to me.